Food, Drugs and Insurance Roles in Modern Society. Number 1329, August 17, 2025. EclaireMD Foundation. Gerald C. Category, Public Health. Preface. After my recent stroke, I have been thinking deeply about the causes of modern diseases, and the healthcare systems that surround them. That is why I began writing more qualitative research articles, which are quite different from my earlier work, that focused almost entirely on quantitative VMT analyses of specific diseases. In the past, my work was like using a microscope, studying biomarkers such as glucose, blood pressure, visceral fat, and sleep in great detail, and linking them to diseases like cardiovascular disease, chronic kidney disease, cancers, and strokes. But now my view has widened, more like using a telescope. I find myself looking at the bigger picture, how processed food, drugs, and insurance interact, how psychological stress plays a role, and how broader social and economic structures shape health outcomes. I even notice the similarity between my mentor, Professor Norman Jones's focus on extreme cases in engineering, and my own 16 years of medical research on extreme health outcomes. This transition also made me pay closer attention to my own cognition. In some ways, my stroke sharpened my ability to reflect and connect ideas across wider domains. While I still value the precision of my quantitative work, I now see equal importance in linking those details to the larger picture of public health and human well-being. Description. From a public health perspective, I want to share a personal reflection on how modern food, drugs, and insurance together form a triad cycle that shapes our health as a society, and how this same system could be turned into a force for better wellness. Industrial society has brought speed and convenience, but it has also reshaped how we live and how we experience health. At first, advances like chemical products and processed foods seem to improve daily life by offering convenience and affordability. Over time, however, these products revealed unintended consequences: reduced nutritional quality, hidden unhealthy contents, and a rising burden of chronic disease, especially in advanced nations, most notably the United States. As health problems multiplied, the pharmaceutical industry expanded to provide what it considered modern medical solutions. Many of these treatments are extremely valuable and even life-saving. At the same time, however, much of the focus has remained on managing symptoms, rather than preventing disease, or addressing its root causes in lifestyle and environment. This approach often leads to long-term dependence on medication, without fully resolving the underlying drivers of chronic illness. Finally, the insurance industry enters as the third piece of this modern health ecosystem. The broad majority of the population pays steady, lifelong premiums while consuming relatively few medical resources, whereas the minority who become severely ill, the extreme cases, account for most of the total insurance expenditures. The unused portion of premiums remains sufficient to support and maintain the financial strength and profitability of the insurance system. This structure by itself is not inherently harmful, but when combined with the other two forces, processed food and pharmaceuticals, it reinforces a cycle within the modern healthcare system that emphasizes treatment for profitability. As a result, the system becomes more focused on treating illness than on preventing it in the first place. Seen together, these three groups, each driven by profit maximization, form a self-reinforcing triad cycle that has shaped our modern healthcare system into what it is today. Processed food introduces easy access and convenience, but also contributes to health risks. Drugs respond to those risks, often focusing on treatment rather than prevention, and encouraging long-term use across the population. Insurance finances the system. Private insurance in capitalist economies collects broadly while spending selectively to maximize its profitability. Even some national insurance programs, such as those in Japan and Taiwan, face waste and inefficiency, and when combined with aging populations, these systems approach near bankruptcy conditions. Each component has its own logic, yet together, they create a feedback loop that defines modern society and its healthcare ecosystem. The most vulnerable groups, the least educated, and the financially strained, face the greatest exposure to unhealthy food, the highest barriers to preventive care, and the deepest dependence on insurance systems. I feel a personal responsibility to speak up on their behalf. The challenge is not that any one sector acts with deliberate harm. The deeper problem is that the incentives of the triad are aligned more toward sustaining the cycle than breaking it. Profit maximization, the core survival mechanism of modern capitalism, links them together. The result is a society that invests heavily in treating chronic disease, while underinvesting in prevention and education. This influence even reaches medical educational system, shaping how future doctors are trained. Ultimately, it calls for a deeper reflection on the entire structure of our modern economic system, not just on the triad itself, because these forces affect every individual's health. The opportunity lies in shifting the balance. If healthier food choices are encouraged, and the resources exist to make this possible, if medicine places greater emphasis on prevention, and the talent exists to lead this change, and if insurance rewards long-term wellness, and the experience exists to redesign incentives, then the same triad system could evolve into a driving force that strengthens public health, instead of simply treating diseases. Such a shift would not only improve individual well-being, but also create a more sustainable balance for industries and for society in the long run.